สวัสดีครับ
Good afternoon, ladies and gentlemen. Welcome to Health Justice in Thailand in the context of COVID-19, a work in progress event organized by National Health Foundation and the Faculty of Medicine Ramathibodi Hospital. My name is Narada Sivathong, or you can just call me Melon, and I'll be your MC and moderator for today. As you all know, that Thailand was the first country to detect the COVID-19 pandemic in a traveler outside of China, less than 1 week after the World Health Organization has informed the world of this new emerging disease in January 2020. Also, it was ranked among the top 10 countries that is the most prepared by 2019 Global Health Security Index. However, despite the good news, Thailand has faced 4 waves of COVID-19 since the beginning of 2020 until now. Besides the emergence of Delta variant of SARS-CoV-2 virus, we also see the decisions that the government has made at the time, and all of these has not only overwhelmed the public health system, but also at the same time exposed Thailand of the disparities of health access and also exacerbated by the inequalities of the country. So today, we'll also be able to discuss the draft report of health justice and also Thailand COVID-19 response, which will demonstrate the concept of health justice through 7 selected case studies. Welcome back to the second half of our event. So the first half of our event, we have already learned about the COVID situation in Thailand, the project background, as well as the case studies of what has been going on. So now we will move on to the health justice presentation, where we get to know more what health justice is and what we can do. And for this presentation, it will be presented by Dr. Bawansom. Dr. Bawansom, the floor is yours. Thank you so much, Dr. Bawansom, for your insights and explanation on health justice so that we get to know more about 3 aspects of justice that we probably have never heard or thought of before. And now we move on to the highlight of today's event, which is going to be the discussion on health justice framework as well as the case studies. Thank you so much, Kun Sinisuda, on your thoughts on this. So basically, we should start to focus more on transparency and people participation to make any political decisions. And I think that is really great because right now it seems like a lot of times people are trying to voice out through social media and through different media, and that is something that the government should take more into consideration. That's what you're saying, right? Yes, exactly. Thank you so much for your insights on this. I would like to also ask for the same questions, but I would like to ask the opinion of Dr. Nathakan Chunchom. What is your thoughts on this fundamental right with the access to health justice, and how we can change the policy, or how can the policymakers consider health justice in all the decisions moving forward?
And so therefore this inequality, whether it be economic, socio-economic, or education.
Thank you so much for your insights on this. So what I can hear is that you have seen that the welfare system in other countries, they have considered all these different factors that Thai people have missed. For example, like the equity of people with money and without money to access to the healthcare, and also the transparency of healthcare, of how people's voice is not being heard, right? So if people can share their ideas and needs and wants, and if their voice are being heard, then of course the vaccine import and also the distribution will be better. So what do you think can be the next move, or what are some of the things that we can do to make sure that in the future, if there is any other crisis coming up, or if there's any other similar situations, then we can deal with this better to make sure that people would have better welfare and well-being? Thank you so much, Ms. Akarasan, for your really powerful presentation. It really shows that COVID-19 not only affects people who are working or middle class income or low income or just the adults, but it also affects the youth who are basically the future of our country, of our nation. And if we would like to change, if we would like to improve our country, we have to think sustainably. And so we have to consider everyone in all levels, really. So thank you so much for your presentation. It's really powerful and useful. And moving on today, we also have a privilege to have another commentator with us, Kun Aphisit Vechachiwa. Thank you so much, Kun Ampisit, for your insights, your suggestions, as well as the encouragement for us to keep on working on this and to make Thailand a better place to live in for everyone. Thank you so much, Dr. Somsak, for your closing speech, and thank you everyone for your participation. Your contribution is really valuable to us. I am sure that by participating in today's event, everyone is now have a better picture of health justice concept, and also you know how to move forward to make awareness and also to make sustainable change in Thai policies. So please kindly stay tuned to the work of National Health Foundation. I will see you again at the next event. Have a great evening.
สวัสดีครับ